Complete Guide to Testosterone Replacement Therapy. A growing number of men are suffering from low testosterone, also known as low T. According to recent studies, testosterone levels may drop as quickly as 2% each year beyond the age of 30. Further research has revealed that men aged 45 or older have a 38.7% prevalence of low T. Naturally, this has resulted in a rise in the number of doctors, particularly endocrinologists, who are prescribing a specific kind of treatment plan called testosterone replacement therapy, TRT. The medical and scientific sectors are developing a far better understanding of how testosterone levels affect longevity and well-being as research advances. Doctors that specialize in men's health are increasingly knowledgeable about the safe and efficient ways to give prescription testosterone. However, what is TRT? How does TRT function? What are the advantages and disadvantages of TRT? What is TRT? A special kind of hormone replacement therapy called testosterone replacement therapy, TRT, is used to raise a person's low testosterone levels back to normal. TRT is actually remarkably similar to the administration of insulin to type I diabetics. Both involve the need to replace an essential hormone that the body is unable to produce on its own with an external source. In the context of TRT, this entails utilizing exogenous testosterone to restore testosterone levels to a healthy range. Exogenous testosterone is typically provided as an injection. There are additional prescription forms of testosterone, including testosterone creams and patches, both of which are absorbed through the skin instead of being injected. While older men make up the majority of individuals using TRT, younger men are now taking matters into their own hands and getting their testosterone levels evaluated. If you are displaying signs of low T, which we shall discuss later in this video, we strongly advise you to do this. Since its initial synthesis in a laboratory environment in 1935, testosterone has been applied in medical procedures. One of the drugs that is most frequently prescribed in the US over the past 10 years is testosterone. Many factors are responsible for the rise of TRT in men being diagnosed with low T, particularly the growing population of males over 50 years of age. The biology of low testosterone is now more understood by scientists and medical professionals. Symptoms of low T, testosterone. Low T symptoms often have a detrimental effect on general health and well-being. Additionally, the symptoms of low testosterone in men tend to worsen over time, which significantly lowers quality of life and decreases motivation to get out of bed in the morning. The following are the signs of low T that affect men most frequently. Decreased libido/sex drive. Erectile dysfunction, impotence. Low energy throughout the day. Loss of muscle mass and strength. Increase in body fat. General depression. Small or shrinking testes. Poor concentration, brain fog. Infertility. Hot flashes. Low red blood cell count, anemia. Brittle bones and general weakness. Hair loss, particularly body hair. Sleep apnea or other sleep disorders. Any or all of these symptoms could indicate that you should consider TRT. Before you make any choices, you must first obtain a blood test to determine your testosterone levels with a trained physician. How does TRT work? You probably want to know how TRT functions now that we have clarified the definition. In a nutshell, TRT functions by supplying your body with the necessary amounts of testosterone. The main androgen in males and females, testosterone affects a variety of biological functions crucial for good health and long life. Low T, for instance, raises the risk of type 2 diabetes, the metabolic syndrome, cardiovascular disease, as well as a host of other disabling health issues. Due to the fact that testosterone is a strong anabolic hormone and directly affects muscle protein synthesis, having low T also makes it far more difficult to gain and maintain muscular mass. Intuitively, if your body doesn't naturally manufacture enough testosterone, your health would start to deteriorate until you find a solution. TRT therefore functions by restoring your body to a healthy range for testosterone, which gradually starts to counteract the effects of low T. The majority of men experience an improvement in their energy levels, vitality, and quality of life once a consistent baseline dose of testosterone has been established on TRT. TRT isn't an instant fix, though, and some guys won't see any positive results until 1 to 2 months have passed. Again, make sure to carry out all of this under the supervision of a qualified medical professional with experience in TRT. What are the risks of TRT? The prolonged use of testosterone may result in some adverse effects, just like with other prescription drugs. Since the aim of TRT is to maintain testosterone levels in a healthy range, the side effects are very minimal. Your doctor should modify the testosterone dosage if your TRT causes your testosterone levels to rise too high. In today's world, testosterone seems to have a bad reputation because many people believe it causes negative side effects and roid rage, which is simply untrue when used in tiny levels, as is the case on TRT. Intuitively, there is a higher danger of negative side effects including gynecomastia, infertility, and high blood pressure if you take excessive levels of testosterone, for example, to improve physical performance. TRT, however, carries just a small amount of risk. After using TRT for a while, some men may observe oily skin, body hair development on the back and chest, and testicular atrophy. Most of the time, these side effects are controllable, and some even go away as the body gets used to TRT. So why do men who take testosterone often notice that their testicles are shrinking? The HPG axis, which includes the hypothalamus, pituitary gland, and gonads, testes, is a negative feedback loop mechanism that the body uses to control the amount of testosterone produced. Luteinizing hormone, LH, which the pituitary gland secretes in healthy people, communicates with the testicles to cause them to generate testosterone, maintaining testosterone levels within the normal range. Since you are obtaining all of the testosterone you need from an exogenous, medical source when you start giving your body testosterone directly, the negative feedback loop functions as a shutdown mechanism of your body's HPG axis. In other words, since testosterone is replaced by TRT, your body doesn't need to create it. Your testicles may get smaller as a result of less LH being produced, which lowers testosterone synthesis in the testes. A decrease in sperm counts is another possibility, which can be problematic if you're attempting to conceive. Thankfully, there are strategies to avoid these TRT adverse effects. Acne and excessive body hair development can be controlled by taking daily showers, grooming, and utilizing a variety of topical skincare treatments. Additionally, supplementing TRT with human chorionic gonadotropin, HCG, a luteinizing hormone analog, can support the maintenance of fertility and testicular growth. But before making any adjustments to your TRT regimen or your prescription regimen, speak with your doctor. Thank you for watching. For more fitness facts, please like and subscribe.